As we embark on this journey of discovery and dialogue, let's remember that we are not just passive spectators but active participants. This virtual space transcends the barriers of time and distance, uh, allowing us to engage in meaningful conversations, challenge existing notions, and share our experiences and expertise. I would like to express my deepest appreciation to our esteemed speakers who have graciously accepted our invitation to share their knowledge and insights. Your expertise and dedication to your respective fields serve as an inspiration to us all. I'm confident that your presentations will provoke discussions and leave a lasting impact on our participants. To the participants, I extend a warm welcome. Your presence here today demonstrates your commitment to personal and professional growth. Remember this as an opportunity to engage, question, and learn. Feel free to actively participate in the discussions, contribute your ideas, and make the most of this valuable platform. I would also like to express my gratitude to the organizing committee, the alumni coordinators, and all those who have worked tirelessly behind the scenes to make this virtual webinar a reality. Finally, I encourage each one of you to embrace this opportunity fully, engage in meaningful conversations, forge new connections, and above all, take the knowledge you gain here and apply it in your lives and work. Once again, I extend my warmest welcome to all of you. May this virtual webinar be a catalyst for learning, collaboration, and transformation. So now we move on to the first speaker. Mr. Reuben, you can share your screen. Meanwhile, I'll make a short introduction about yourself. So the first speaker for the day we have is Mr. Reuben Kaha. He's an development professional with 9 years of diverse experience in public health, focusing on health management information systems, monitoring and evaluation, and information technology supporting HIV and AIDS, malaria, nutrition, and maternal health projects in the public health space. He holds a bachelor's degree in mathematics and computer science from Federal University of Agriculture, Makurdi, Nigeria, and a master's degree in public health from Texila American University Zambia. He is adept in designing, managing, and implementing M&D systems in the context of public health programs with a keen understanding of donor landscapes. And the topic is going to present today is on the impact of community service delivery on nutrition outcomes in Nigeria. So over to you, Mr. Reuben.
All right, thank you very much, and thank you everyone on the call for taking out time for this presentation. Just as the hosts have presented, I will be taking on the presentation on the topic, the impact of community service delivery on nutritional outcomes in Nigeria. So just for us to look at the background, childhood malnutrition remains an important public health and development problem in low and medium income countries. Nigeria is one of the low and medium income countries. According to UNICEF, ranks second among the 10 countries contributing to 60% of the world wasted under 5 children. As guided also by the WHO, Nigeria has adopted a shift from facility-focused delivery to task-shifting approach to include community-level home visits. Community-integrated management of childhood illness is a program that actually employs the use of community-based volunteers to address child health and nutritional challenges of the under 5 and has the potential to reduce the morbidity and, of course, the mortality resulting from poor nutritional and feeding practices. These presentations, however, seek to look at some of the impact of community-level delivery in specific areas so far. Just for us to get a grasp of what we'll be explaining ahead, the definition of the key terms. One, which is community service delivery, is actually an organized and coordinated provision of public service organizations, government agencies, and non-profit entities to meet the needs of community members. And then the nutrition outcomes. These are actually measurable effects of dietary intake and nutritional interventions on the health and well-being of individuals or populations. And of course, Nigeria is a country located in the Western African region, and it's actually the populous country in Africa with a large population and of course significant economic potential. Malnutrition, a condition that arises from an imbalanced intake of nutrients, either through deficiency, excess, or improper proportions, leading to various health issues. Micronutrient deficiencies, the lack of essential vitamins and minerals required in small amounts for proper body function and overall health is what is actually regarded as micronutrient deficiencies. And of course, the CHIPS program, it's actually a community health influencers, promoters, and services program established by the National Primary Healthcare Development Agency in Nigeria that was endorsed by the federal government of Nigeria, that is actually designed to improve on the village health worker concept. Now, according to WHO, there are actually 3 broad subgroups of conditions that can actually lead to malnutrition. Malnutrition, as defined in the previous slide, refers to deficiencies or excesses in nutrition intake, imbalance of essential nutrients, or impartial nutrient utilization. These 3 broad subgroups, broad groups of conditions include undernutrition, which is actually wasting and stunting and underweight. Wasting and stunting as a challenge in Nigeria, to be specific, is more prevalent in the northern region of Nigeria. Wasting is actually a condition that indicates recent severe weight loss due to insufficient food or infectious disease like diarrhea, increasing the risk of death in young children through treatment. Young children, rather. Of course, this we have treatment that is actually made possible. And then stunting actually is as a result from chronic undernutrition linked to poor socioeconomic conditions, such as maternal health and frequent illness, hindering children's physical and cognitive development. And underweight is actually children with weight or for age that may be stunted and wasted, or both. And then another subgroup is micronutrient-related malnutrition, which includes micronutrient deficiencies, that's the lack of important vitamins and minerals, or micronutrient excesses. Their deficiency represents a major threat to the health and development of populations worldwide, particularly children and pregnant women in low-income countries. And then the last but not least, the diet-related non-communicable disease. This includes actually heart disease, stroke, diabetes, and some cancer. Abnormal or excessive fat accumulation can impair health. Overweight and obesity result from an imbalance between energy consumed, either being too much, and energy expended, either being too little. Unhealthy diet and poor nutrition are among the top risk factors for those diseases that I've mentioned earlier. Then we talked about complementary feeding. What do you understand by complementary feeding? What we have here, it's actually an introduction of nutritionally adequate and safe food to complement breast milk at 6 months. It should be frequent, of right consistency, energy dense, and of course, different varieties. The child should be fed patiently and given attention. Foods should be prepared, stored, and fed hygienically to children. Micronutrient powder can be added to enrich the food. Below are the benefits of actually using this complementary feeding. 1, a child is less likely to die. There's actually an optimal growth of that child. There is actually a prevention of malnutrition, which is most malnutrition during complementary feeding phase, which is from 6 months to 2 years. There is actually a better psychological development, improved cognitive development, and of course, less respiratory and diarrhea episodes. We now talked about exclusive breastfeeding. Exclusive breastfeeding means that the infant received only breast milk. No other liquid or solids are given, not even water, for the period of 6 months after delivery. We'll have benefits of exclusive breastfeeding includes breastfeeding is actually an effective contraceptive method during the first 6 months. It aids expulsion of placenta because the baby's suckling stimulates uterine contractions. It actually also reduces the risk of bleeding after delivery. Immediate and frequent suckling prevents breast engorgement. It is economical and reduces mother workload. It reduces risks of breast and ovarian cancer. It actually saves infant lives. It meets the needs of the baby for the first 6 months. For adequate growth and development, clean and readily available. It also contains antibodies that can help fight for disease. It helps jaw and teeth development and, of course, foster mother and child bond. Now we talk about the methodology, what is actually obtainable in Nigeria. Nigeria operates a program that is actually called CHIPS, which means Community Health Influencers, Promoters, and Services Program. It was actually adopted in 2018 to revitalize primary health care and work towards securing a universal health coverage. As at 2023, all the 36 states, including the Federal Capital Territory in Nigeria, implement this program. This is a summary of the CHIPS program. It's actually a program that is actually modeled to integrate all existing community-based health services and personnel in order to contribute to reduction of maternal and child morbidity by creating demand for and improving access to an equity coverage with essential primary healthcare services. The objectives include to equitably expand access to basic primary healthcare services, to actually improve demand for primary health care services by individual and household, to foster community participation and ownership, to promote public-private partnership in primary healthcare development, especially at community level, and to promote female empowerment and socio-economic development. There are actually agents that actually stand to actually make this program effective. We have 5 of these program agents, one of which is community mapping. They do community mapping by doing household numbering, collection of basic demographic information, and identification of target populations in the catchment areas where these services are needed to be provided for those people who are mostly in need and vulnerable for the program. Then the demand creation for health services, which educates on importance of antenatal care, birth preparedness, health facility delivery, and what have you. They also counsel on importance and monitor uptake of immunization, which is how kind of integrating other health interventions into the nutrition projects. And then we also have health education and counseling. It has to do with educating and counseling on the basic preventive care and, of course, non-communicable disease, as we mentioned in the previous slide, that has to do with diabetes, stroke, and cancer. And then, of course, HIV and AIDS and hepatitis, malaria, and other program interventions. And of course, agents that also stand as to provide support and treatment services. Their role is to actually support development of birth preparedness plan, to provide essential newborn care, provide disease-specific treatment for pregnant, under 5 for cough, fever, and diarrhea. And of course, identify and refer severe acute malnutrition, and provide basic first aid needs, and facilitate referral and follow-up. Then lastly is disease surveillance and community level data collection. The importance of data collection, of course, monitoring and evaluation can never be overemphasized in any program at all to actually make sure that there is actually an impact on the project. This is actually gears towards supporting community surveillance and report disease with epidemic potential. It also record and report activities during encounter with household members. There are actually studies that showed community-based delivery has driven impact to tackle malnutrition. Some of the 2 studies that I've gotten were: 1, the effect of community-level intervention on nutritional status and feeding practices of under 5 children in Ile-Ife, Nigeria. Ile-Ife is actually located in the southwestern part of Nigeria, in Osun State to be specific. The methodology that was used in carrying out this study was actually a cross-sectional comparative study using multi-state sampling. The results entails the weight index of similar born local government areas. Both male children in the non-implementing LGS had low weight for age, 16.1%, as compared to those implementing LGS, which was 3.6%. There was also a significant decrease in WAC measurements for children aged 12 to 23 months between the implementing and non-implementing communities. The results for this study also show a higher percentage of caregivers in the non-implementing area introduced complementary feeding earlier than 6 months, which was actually 19.3%. Another study was the effect on community home visits and peer group nutrition intervention delivery platforms on nutrition outcomes in low and medium income countries. The location was for low and medium income countries, which Nigeria is one of the countries. The methodology was they reviewed 219 full text articles for eligibility, and a total of 83 studies were included in the full review summaries. The key characteristics of the community healthcare workers or lay counselors, home visits, and mother-to-peer group studies, which are the focus of the papers. The results were that the differences in coverage varied by platform, while home visits achieving higher average coverage than peer groups, which was actually 59.5% versus the 50.5% among included studies. There was also an effective community delivery modalities, which was actually needed to achieve maximum gains from evidence-supported interventions. Community service delivery can significantly impact nutrition outcomes in Nigeria through various mechanisms. A few of these mechanisms are summarized is to, one, promote local food sources, encourage the use of locally available nutritious food in community programs. You will agree with me that in some of the sub-national levels, being it at the ward or community level, as we might call it, some people don't actually have access to these food supplements to buy because of, the economic nature of the communities. Possibly, maybe they don't have access to the economic nature of it. And of course, the government that support this in times where the government is actually facing economic hardship, you will find it very difficult for government to actually support, because at the end of this program, you should be able to have what is called sustainability. They should be able to sustain. So promoting local food sources will actually give an avenue for an alternative for them to actually make do with what they have at their local level. So we encourage the use of local available nutritious foods in community programs. And of course, enhance community engagement. You strengthen community involvement in planning and implementation of nutrition programs. You involve the community members, but through involving them into the picture, you actually know what they need, and not necessarily planning for something that they, at the end of the day, is not what they are looking for. So in trying to include them in your implementation and actually involving them right at the planning stage will actually give you an ample opportunity to actually identify what nutritional needs these communities actually want. And then last but not least is the sustainability. We focus on creating a sustainable program that can continue without external funding. Just as I was explaining, there should be the overall goal of this is to actually have an impact, and of course to be able to sustain the communities in the absence of external funding by actually trying to raise the point one, promote local food sources. There will be actually that sustainability for them to carry on, even if there is no funds or resources allocated specifically for, arranging food supplements and other nutritional needs for such communities. Conclusions. The topic underscored the pivotal role of community service delivery in enhancing nutrition outcomes in Nigeria. Effective community-based programs characterized by local engagement, education, and accessible services have demonstrably improved dietary practices and overall health. The findings advocate for sustained investment in community-driven initiatives and policies that empower local stakeholders, ensuring the scalability and sustainability of nutritional advancements. Of course, this program has actually impacted a lot on the states, especially the under 5 mortality rate as a result of malnutrition in the northern region of Nigeria. With this intervention, there's actually a sharp decline in the increased number of, in the decreased number of mortality rate for under 5 children. And of course, enhanced collaboration between government entities, non-governmental organizations, and local communities is imperative. This is actually imperative for actually addressing malnutrition and fostering long-term health improvement across Nigeria. Thank you, and over from me.
Thank you, Mr. Reuben Kaha, for your wonderful presentation. Now the floor is open for questions. If you have any queries, you can use the chat box or the Q&A, and also you can raise your hand so that you can express your views. Yes, Dr. Abraham Nigor, you can unmute yourself and speak.
Thank you so much, and I want to, give a word of appreciation to Mr. Reuben, who presented, the most comprehensive presentations on, nutrition. I just want to ask one question in relation to some findings concerning how nutritional issues cause issues like cancer. That was in his findings. If you can elaborate it a little bit further for better understanding. Over to you.
I can barely hear you. Your line was breaking at some point. If you can take that over again, I would really appreciate it.
Okay, thank you, Reuben. My question is about how, the nutritional aspect of your study came to the conclusions of, the finding on cancer.
Okay, thank you very much. Am I taking other questions, or I should answer at a go?
You can answer one by one, Dr. Reuben.
Okay. All right, one. Nutrition actually can affect cancer in several ways. By the way, thank you very much for that question. It shows clearly that you were attentive and rapt in listening to my presentation. I must appreciate that. So, just as I said, nutrition can affect cancer in several ways, one of which, number one, certain food and nutrients may help prevent or contribute to many common cancers. Eating actually optimal diet for cancer may reduce your risk up to 70%, and you will likely help recover your cancer as well. Eating a diet rich in whole grains, vegetables, fruits, and legumes can actually decrease your cancer risk, as well as other chronic diseases like diabetes and heart disease. I don't know if that answers your question. Because the last point I talked about, all of this, just as we explained what malnutrition is, we're actually talking about lack of deficiencies, of course, them being in small quantities. So when you eat of this diet that are rich in whole grains, vegetable, fruits, and legumes, it can actually help decrease your risk. But eating other foods that are non-nutritious can actually lead to some of these diseases like heart cancer, diabetes, and of course, diabetes is actually a trigger of some of these factors. Once you have the diabetes, you have an increased risk of, high blood pressure and all of that. So that's actually one of the reasons why we say nutrition can actually affect cancer. Don't know if that answers your question. Thank you, and over from me.
Thank you. I think my question is answered satisfactorily. Thank you.
All right, thank you very much, sir. I saw a question down by Daniel Haruna. Can I go ahead?
Mr. Reuben, you can go ahead with the question.
Okay. Mr. Daniel Haruna said, looking at the role of nutrition in health, what other recommendation do you think the government can play despite economic issues faced around the world, and in particular the Nigerian government to improve food supply? Yes. The list I actually gave, I just summarized to give actually 3 recommendations. There are a whole lot of recommendations. One of which is to curtail government's inclusion to actually help, despite in economic challenges, during the challenging times as it relates to the economy of the nation. One of it will be to promote agricultural practices to actually increase food supply, to encourage local food production through community gardens or agricultural training can actually improve food security and dietary diversity. So I know Nigerian government, what they are doing right now, they are trying to, because of this shortage of food supply, not to talk about eating the right kind of food that you are supposed to eat, but the ones, even the food is not readily available. What the government is trying to do now is to actually increase, encourage people from farming and basically promoting agricultural practices that can encourage local food production to have the food in abundance. And doing that, it can actually help to sustain those people who are at the sub-national level, which is the people at the community level, so to speak. I don't know if I've answered Daniel Haruna, your question. There are a whole lot of it. There's also a program that Nigeria is actually doing in the northern region because they are most vulnerable. There is what is called school feeding program. They actually implement school feeding programs to ensure that children receive at least one nutritious meal a day, which can actually help improve their overall health and academic performance. So these are other recommendations to give for government to key into. Mr. Haruna, I don't know if I've answered your question.
Maybe Arun might be, suffering technical issues with his internet.
Okay, I have seen his reply.
Dr. Reuben.
I've seen his reply.
Okay,
Yeah.
Dr.
Yeah.
Reuben, your presentation has piqued my attention, and I would
Okay.
like to continue asking some questions from you because, for the benefit of everyone and even me personally to understand some of the things better. You mentioned something about, nutritional issues that cause deficiencies and that lead also to diabetes and, blood pressure and also heart attacks. And if you can a little bit elaborate, for us to understand it better, not necessarily for, professional growth, but even for the public health benefit to all of us. Thank you.
Okay, thank you very much, Doctor. If I understand your question clearly, you want me to deep dive on the nutrition, how nutrition can affect cancer, right? And can possibly lead to other diseases like
Diabetes, yes, diabetes,
diabetes.
yes, diabetes, blood pressure, and heart attacks. Yeah. If you can, elaborate it a little bit further, for public health benefit for all of us, because some people may be struggling with such situations. And
Yeah.
if, like now, having encounter with you like this, that information would help me to support some individuals around me. Thank you.
All right, thank you very much. One of the reasons why we say want you, as a human being, you actually require food in the right proportions to be eaten. That is what is called a balanced diet, and that's what makes it nutritious. However, there are some people that eat any kind of food that comes their way, not minding what they are eating. If you go to a restaurant, number one, you mind your, we are not saying that you should not eat salt. But as you grow older, you have a high risk of getting this disease. You agree with me, in Nigeria, the life expectancy rate is 50 years. Once you reach that age, you begin to experience some of these things. Some of this food that we eat actually have a long-term impact on our health. Some of them might not actually manifest now. The kind of food you eat is very important, so you mind what you eat. At some age, there is actually the kind of food that you should recommend in eating. Take it for instance, when you are when you are diabetic, there are actually kinds of foods that are recommended to you to be eaten. Number one, you don't have to eat a whole grain, but you have to be mindful of the quantity that you eat and all of that. As a human being, we actually need at least 70% of carbohydrates in our diet. Now, that is not to say as a diabetic, you should not eat anything carbohydrate, because you need it. Because for you to eat a balanced diet, carbohydrate must be there to complement other classes of food. Now, if you are eating foods that are not nutritious for your health, being it nutritious, that does not mean you abuse it. Every food is good, but when you abuse it, you stand the risk of this disease, which I just mentioned. Number one, somebody who is not actually concerned knowing his or her weight or BMI, so to say. You know, at a point, you might actually be obese, you don't know. The kind of food that you are taking might actually increase that risk. Something that might actually manifest in 2 years' time, it will manifest in 1 month, considering the type of food that you take. So these are the reasons why we say you need to eat a nutritious food. Being it nutritious doesn't mean you abuse what you take. You eat the right food in the right proportion, in the right quantity. I don't know if I've answered the question, sir.
Thank you, Dr. Reuben. My question has been answered satisfactorily. And, these are kind of information, that we want, because the world today is, has a prevalence of high blood pressure, and then diabetes. And, these are the things that you cannot go without seeing, individual patients having such situation, or your relative or anybody, colleagues around you. And that's why if something is happening around you, then you should also understand what it is and why it happened that way, why it happened to so and so than the other one, and what are the modalities for preventing such situation to happen, so that people understand. And I really appreciate your research on this area. It is very much informative and it helps people. Thank you so much.
Yeah, thank you very much, sir. Thank you very much, sir. So I'm trying to go through from the question section. Okay, from Abola Diagbola, he said, what is the role of family size in achieving a population that is healthy? Malnutrition certainly have a relationship with family size, and it is expedient to have a campaign to scale down the population, Nigeria, which is growing at average of 2.4%. Yeah, no doubt. Population size actually have an impact on how healthy a family will live, because you will agree with me, in a family where there are 2 children and the mother and the father, the kind of food they will eat in terms of quantity, and both in terms of quantity and of course quality, will be different from a population where in a family you are seeing 20 children depending on the parents with a low food to provide or cater for them. That in terms of quality will be compromised, and of course the quality will also be compromised. Now you are asking birth control. My research does not actually have to do with birth control. It's beyond the scope of my topic. So I will advise you look at my topic very well, because my topic is not actually looking at how I will scale down the population of the country to actually have impact. The only thing I talked about was how government can actually come in with the growing population. As the population is growing, there should also be that demand creation in trying to scale up food production to actually for food security and all of that. Mr. Agbola, I don't know if I've answered your question. I saw 2 of your questions. Okay, it's the same question anyways. So think I've answered your question. Any other question?
Yeah,
The
Dr.
ones I've
Simon.
seen from the chat box, I think I'm done with them.
Yes, Doctor. Dr. Simon, you have raised your hand. If you have any questions, you can unmute yourself and speak.
All right, thank you very much, the presenter, for the wonderful presentation. I just want to know concerning the identification of a malnourished individual, be it children or adult. What can we use to identify that this one is malnourished? That is one. And then for those that are malnourished, what are the available services that we can render to them just to shape their health conditions so that they can be okay? Thank you.
Your line was cracking at some point. I could barely hear you. I don't know if it's my network. Let me reshare.
Okay. Okay. Hello. Can you hear me now? Is it better?
Yeah.
Hello. Okay. I was saying that what are the checks that you can put in place to identify those that are malnourished? That is one. And having identified those that are malnourished, what are the clinical services that you can render to ensure that they come out of that malnourishment? Thank you.
Okay, I get your question now. If I understand your questions clearly, you are asking for the checks put in place in order to, map up or identify those children who are malnourished at the sub-national level, be it at the world level or community level. Am I correct?
Yes.
Okay. I will give you a case study of one of these services that's actually rendered in one state in the southwestern part of Nigeria, which is Oyo State, close to Osun, which I earlier talked about, a research that was actually carried out in Ile-Ife. They're actually border towns. So there is actually a nutrition project that's going on in Oyo State, and that's actually leveraging on the CHIPS project, which is actually being mandated by the National Primary Healthcare Development Agency in Nigeria. What they do is, number one, they actually, from my explanation, I talked about scaling up this. They have what you call agents. So there are agents that actually serve as people that can actually map those identified populace. Now, if you agree with me, there are some communities that are hard to reach in Nigeria, for instance. Some of these communities, number one, the network to even reach out to those people is a problem. Access to road, transportation is also a problem. So trying to do demand creation, what the National Primary Healthcare Development Agency is leveraging on is leveraging on the people that are already existing in these communities that have a health knowledge. And of course, there is an institution put in place where they actually build their capacity. Their know-how on how to actually, be it in clinical, be it in monitoring and evaluation, in collection of data and all, to be able to, decentralize whatever support they are getting to those levels using those agents. So the agents are actually people that stand in as a middle person between the community people and, of course, the people providing the services. And in order to solve these issues, when you identify the malnourished, when they identify the malnourished in these communities, which is the clinical management that you are talking about, they link them to the primary health facilities in those communities. If it is actually a case that cannot be solved at that level, they now do what is called referral. It was actually also in my presentation. They do referrals, immediate referrals. But at least there is actually a phase aid that's done at the primary health care center to actually resuscitate that child that is actually malnourished before escalating it to a nearby facility. that can actually handle that kind of emergency. So there's actually that flow, that checks and balance put in place to actually, identify them from the first place, doing a prioritization metrics to actually identify those ones that are minorities. And of course, when they identify them, they actually refer them to the primary healthcare facilities offering these services. And if they cannot be handled at that level, they escalate it by way of referral to an Apex health facility. Thank you very much.
Thank you, Dr. Reuben, for the wonderful presentation and taking up the questions and answering them.